Welcome to Quarantine Break. I'm Kiana, founder of Eat Soccer. Thank you so much for joining us this week. And in this session, we're going to learn about the power of using your hands. We're so pleased to have with us global healing arts instructor, Vickie Torrey, who's also an oncology massage expert. And she's going to talk about the work that she does, how she teaches at Costa Rica School of Massage Therapy, and how she helps caregivers balance the stresses of the work that they do. Thank you so much for joining us. What are the healing arts?
Good morning, everyone. And thank you, you guys, for having me present this today. So the healing arts can range from acupuncture all the way to zero balancing from A to Z. There's so many healing arts. But I feel that healing arts they're any healing modality that we use to heal ourselves by bringing our body, our mind, our spirit, and our emotions into harmony and into balance. So that's what I consider the healing arts.
And what are some examples of the healing arts that students may or may not know?
Okay, so some of the examples of the healing arts is I was trained in polarity therapy, which is an energy work where you don't put your hands on the person's body. You could, but you work without putting your hands on the person's body. Craniosacral therapy, which is a very light, very extremely light touch modality. Also sports massage, which is very deep. You go in, you do those compressions, you get everybody relaxed before the marathon, after the marathon. Also prenatal and pregnancy massage is one of my favorites. I did that for 12 years. Infant massage, massaging babies. The compassionate touch massage is something that I kind of grew into when I started working in the hospital system. I was on an integrative health medicine team or health team at the hospital, in a hospital system in North Carolina. And I started getting cancer patients coming into my office for massage. And I fell in love with, working with cancer patients. And so before I knew it, I had shifted to this deep love for oncology massage, which is my specialty now. So, so you have sports, you have deep tissue, you have neuromuscular therapy, and then your relaxing Swedish massage. We're all trained in that as one of the first modalities that we learn how to do.
And what inspired you to become a massage therapist?
Oh, wow. Okay. So my story is this. I went to visit my sister who was living in the San Francisco Bay Area, and I went by myself. I left my two daughters, De'Ara and Serena, at home, and I went on a solo vacation. And my sister said to me, when she picked me up from the airport, she said, listen, I have a gift certificate for you for therapeutic massage, and you're going to do it. And I was like, no, I'm not, because at that time I was very, very protective of my personal space. You didn't come up and hug me or kiss me unless I gave you permission. And she knew that. So she knew she was challenging me. And I said, no, I'm not gonna do it. Thank you, but you better let somebody else have that gift certificate. So a couple of days later, I was in San Francisco, sort of kind of browsing around the warehouse district. And I see these really happy people come pouring out of this building. And they have on these t-shirts and they're just laughing, but I don't see who they are at first. I saw they look happy, whatever they're doing in there, that looks like that might be something fun, right? And so then I finally noticed it said San Francisco School of Massage. And I was like, oh, these are massage therapists, right? And underneath the school name, it had, your future is in your hands. Your future is in your hands. And I said, what a neat slogan. That's great, having no clue that it would impact me in my life so strongly. So I ran back, told my sister, yeah, let's go get that massage. I went and got the massage. I went to Costa, California, which is known for mud baths, sea wraps, all kinds of spa modalities. Did my massage there, got out off the table, and I knew this was going to be my life's work. And I went out, I stumbled out into the lobby because I was still so relaxed from this massage. And I said, this is what I'm going to be doing. I'm going to be a massage therapist. They thought it was the most ridiculous thing that they had ever heard. They're like, that's crazy. A massage must have really tripped you out. And I was like, no, that's what I'm going to be doing. So I got back to Charlotte, and I could understand why they said that because I live in the South. And during that time, therapeutic massage was not legal. There was another type of massage that was sort of like undercover. And they really didn't have any schools. But I waited and I just knew, I felt this sense of confidence that this was something that I was supposed to do in my life. And within a month's time, they opened up a massage school in Charlotte, North Carolina, where I lived. And I became one of the first graduating students of that massage school, Therapeutic Massage Training Institute, Charlotte, North Carolina. I love it. It's still in existence. So it's a great school. It still is. So TMTI.
So I know that you do a number of different types of massage. What types of communities of clients do you serve?
Oh, wow. Okay. One of the things that I have to kind of remember is that this is year 32 for me of being a massage therapist. So I have been in the company of a lot of wonderful people. Okay. Like I said, I've worked with pregnancy massage for quite a long time. I help train moms and dads and grandmamas how to do infant massage for babies. I've also worked in situations where people have been traumatized. So I loved working with people who've been traumatized for whatever reason. And also there was for a couple of years, I worked with people who were losing weight. So they would be on my table and they'd just be like, just barely fitting on my table, right? And what I would do is they would come in for a regular appointment. I love this. And as their body decreases and they got healthier, their weight, their body dimensions began to decrease, and they started feeling healthier, loving their body. Every time they would have a massage, I would say, can you feel where my hands are? And they would say, oh my God, my body is so much smaller. But if I hadn't done that, they said they would not have been able to recognize that they were actually losing weight. So that was really neat. I've done lots of massage work in Brazil because I live in Brazil part of the year, and I love Brazil. And I've done quite a bit of body work there, oncology massage, working with children who were part of the homeless population. So I've worked with people who were in homeless situations. I've worked with people who had like $1 million homes. I also worked with some athletes, some athletes. We're not, as massage therapists, we're not allowed to tell you who our guests, who our patients are, clients are, but they can say, oh, Vickie was great. But we can't do that. So I've done a lot of different locations. I worked with, for several years, I worked with women who had experienced domestic violence, which was something that was dear to my heart, teaching them relaxation techniques and how to massage their children. So those are some of the places that I've worked.
Now, you've been an instructor at the Costa Rica School of Massage Therapy, and you also conduct retreats there as well. What are some of the courses that you teach, and what is a typical week like for you as an instructor?
Okay. Costa Rica, I love Costa Rica School of Massage Therapy, okay? I love it. That was another leap because, who knew that I'd get a chance to teach down there? It's in Samaria Beach, Costa Rica. Shout out to Samaria Beach. Anyway, what happens is they hired me years ago, but I started teaching there in 2007. So I've been down there 12, maybe 13 years now. And the first classes that I started teaching were ethics, professional communication, and psychology of touch, basically body psychology. And they also allowed me to teach oncology massage. So they were one of the first schools that said, okay, we think oncology massage is important. So they set a time aside for me to do that while when the students like on the weekend, right? We did the oncology massage training, and that's when I started doing the training on the beach because I was Samara Beach. I was 5-minute walk away from the beach. So my typical day would be I would get up. My class starts at about 7:15 or 7:30 in the morning. And what I would do is I get up and I would go to the beach like sunrise. I see the sunrise. I walk the beach. I do my meditation. I do my qigong. I get myself together and I come back and teach. And I mean, that is just a glorious way to be able to teach. You know, it's not a traditional way of teaching, of course, but it's a lovely way to start my day. So that would be the way that my day would go, my week would go. And I would teach. After that, you know, yoga, whatever it was that they were offering, get me some good Costa Rican food that I love, some beans and rice and plantains, whatever it was they had. Go to the bakery, Roots Bakery, shout out Roots, get me a brownie. So yeah, it's not a typical teaching situation. It is teaching in paradise.
That's awesome.
Yeah.
As someone who's experienced working with caregivers, can you share what types of tools and tips that you provide this community? And then can you give our students some tips that they can use if they're helping to take care of a sibling or another family member?
Yes. Okay. I love caregivers. I love caregivers because I realized sometime early in my life that I was a caregiver and that I had been taking care of people for a long time. Now that's one of the things that I try to help caregivers do is to recognize that first, hey, you are giving care to someone that you love. You are a caregiver. A lot of people don't realize that they are caregivers. They're in the middle of it. What happens with a caregiver is that they get so caught up in the routine of their beloved's life, you know, making sure they get breakfast, making sure the medicine is taken, making sure they get bathed, making sure that they're comfortable, making sure they get to the doctor's appointments and all that, picking up prescriptions. They get so caught up in that routine, before you know it, they don't even realize that they're giving care. And what happens is when they get caught up in the routine, they stop taking care of themselves. All of a sudden, they forget to take care of themselves. So what I love to do is to bring that to their attention. Hey, number one, you're a caregiver. Two, you need to take care of yourself. Like you need to learn how to breathe. So I'm writing a book called Bringing Joy to the Caregiver, Bringing Joy to the Caregiver. And it's full of all kinds of either free or really affordable tips of ways that caregivers can take care of themselves. Breathing exercises, stretching, simple yoga techniques, meditation, you know, like simple meditations, color therapy. I didn't tell you about my book, but this is my book, Joy Bringers. And Joy Bringers has color therapy in it. Now, color therapy, we use color therapy even with my clients in the hospital system. When they come to see me, we will use color therapy to help them heal themselves. So what you do is basically you create, look at a design or a mandala or a point, a focus point. And you focus on the focus point and you imagine a color that you like. So you're using yellow, for example. So you imagine the color yellow, you close your eyes, you imagine the color yellow, you take a deep breath. And as you breathe in, imagine that you are breathing in the color yellow. And then you bring that color down through all the different parts of your body. And you imagine that color is healing you. And it's been so effective. There've been lots of research studies done on how effective color therapy is. It really works. Mm-hmm. And it is, it's something that you can do yourself. And it brings you back to, hey, I'm in charge of my self-healing, which we all are. Mm-hmm. We're in charge of healing ourselves. So color therapy helps you do that in a beautiful way. This is my book, Joy Bringers. You can get it at, the online bookstores, Barnes and Noble, Balboa, Amazon. Yeah.
So prior to becoming a member of the Healing Arts community, your first career was as a social worker. Can
Yes.
you give students who may be dealing with the anxiety of not being able to go to school or see their friends or interact with people as they normally would, any kind of tips or suggestions as to how to deal with this time of being sheltering in place at home?
Yes. Okay. Well, yes, and I want to say, like, as the type of counselor that I was, or well, I'm still a counselor. You never get rid of that. But the type of counselor that I started my career being was a crisis counselor. So I was a diagnostic crisis counselor. So people would call in with some emergency, they were in some traumatic situation, and I had to walk them through, getting calm and getting them to the place of where we could decide what they needed, like what services they need, where did they need to go, what did they need to do in order for them to bring their life back in balance. And so that's something that's part of me. Like, one of the first things I learned how to do was to just take a breath. And anybody who knows me, that's around me, knows that that's the first thing I want to tell you to do. Is if you feel like you're getting stressed out, you feel a little bit anxious, or you feel bored, you feel like there's nothing that you really want to do, that life is not really going well for you. When you take a deep breath in, maybe do a count of 4, a deep breath in to a count of 4, and then hold that breath to a count of 4, and then release that breath to a count of 4. You want to try it?
Yes.
Let's try it. So we're going to close our eyes, and we're going to inhale to the count of 4, 2, 3, 4. We're going to hold 1, 2, 3, 4. We're going to release the breath. 1, 2, 3, 4. That brings you into focus immediately, and it sort of gets rid of all that outside distraction. Okay. And the other thing that I say is, think about all the good things that you have going on in your life right now. I think the number 2 would be to look at things that you can be grateful for. If you kind of shift your emotions and your mind, your brain, into thinking about things that you're really happy about in your life, that okay, you have food, okay, you do have the latest technology, okay, you do have parents that love you, you do have brothers and sisters, you do have a family, you do have a home, you have lights, gas, water, everything that you need to have, and it's there right there for you. And you have also that's within yourself, that you can always go into inside of yourself, tap into inside of yourself, and reach that space of calmness. So I would say, breathe, be grateful, and just enjoy yourself.
For students who are interested in learning more about the Global Healing Arts, massage therapy, or even Costa Rica School of Massage Therapy that you teach at, what resources are out there that you suggest they take a look at?
Okay, now I belong to American Massage Therapy Association, AMTA, and I've been a member since 1988. So I truly like that. AMTA has a lot of information. AMBP, which is another professional organization for massage therapists and body workers. You can look at NCBTMB, which was our national certification board. Things are changing so much in the world of massage, so things are shifting. And also look at your state licensing board. They should have a lot of information for you. And as far as Costa Rica School of Massage Therapy is concerned, they have a wonderful website, CRSMT. You just Google that and it comes up, and it will tell you about the programs, and it also have a link on there for continuing ed where you can click on. You can see my holistic adventure retreat, oncology massage by the sea. You can see me. If you want to come on down and do the training. And it's a beautiful training. It's you have adventure, and you have also you're learning oncology massage techniques, and it's for caregivers, and it's also for massage therapists. So anybody actually whose heart feels like they want to come down and join us. But we're going to be doing zip lining. We're going to be cooking Costa Rican food. We're going to be getting some salsa dancing in there. We're going to be surfing, horseback riding, mountain climbing, yoga at sunrise, and just quiet walks on the beach. If you don't want to do any of that, you can just walk on the beach by yourself and be meditative and be quiet and just get away from it all. So come on down to the retreat, okay, Costa Rica.
I noticed that you're sitting on your massage table. Are there any tools that you know, that are your favorites, and can you explain a few of them to us?
Okay, yes. Well, this is a typical massage therapist trait right here. Okay. What I mean is when you come into our office, we're going to have a little section on a desk or a table that's like our workspace, and it's going to have things like a candle. We use candles. We love aromatherapy candles. This is a candle. Actually, this is a handmade candle from one of my friends in Brazil. She makes candles. We always have some kind of music, right? Mm-hmm. So we have some kind of relaxing music, or not. We may use drumming. You know, depends on what energy level you come in. If you come in high energy, you need something drumming, we got some drumming for you. If you need something slow and soft, we have some slow and soft for you, okay? But we always have some kind of music, okay? We use a lot of towels, as long as, not as well as sheets, lots of sheets, because we have the sheets, we change sheets after every session. So we use a lot of clean sheets. Of course, different types of massage oils. And believe it or not, we have always, in our offices, we always have hand sanitizer. Yeah, we've always had hand sanitizer because we never know when we're going to need to use our hands to do massage. So we want to make sure our hands are clean and clear in order to do massage. So those are just some simple things that you will see. We'll have books, kind of like inspirational books sometimes, and of course, all the soft music, some aromatherapy with essential oils. So that's typical for us right there.
Lastly, what's the best piece of career advice that you would give your younger self?
Okay, I would say to young Vickie, it's not that serious. I would say it's not that serious. And the second thing I would say to her would be, whenever you are put in a situation where you have to approach someone, let's say you've done something, let's say, for example, as a child, you broke something that belonged to your mom, something that you knew was really special, to your mom, and you're waiting to get up the nerve to say to her, okay, Mommy, I broke your watch or whatever. And you're creating these stories in your mind about how bad it's going to be. It's just going to be horrible, right? Well, the stories in our minds are a whole lot worse than what actually happens. So what I suggest is you take that breath, remember that breath, you take that breath and you kind of ground yourself, and then you say to Mommy, I broke your watch, and you just breathe and see how she responds, right? Or you can create a story that says she's going to respond okay, instead of creating the monster story. But yeah, that's what I would suggest, that, be brave and say it, because it's never as horrible as you think it's going to be.
Oh, that's wonderful advice. Thank you so much for joining us today. If anyone has any questions, I don't think we have any at the moment. We have coming up at 1 o'clock, How to Buy Your House by the Book with real estate attorney Crystal Kimbrough. So make sure to tune in with us at 1 p.m. Thank you so much again, Vickie Torrey. And how can they find you on Instagram?
I'm at Joy Bringers Retreats on Instagram. So you can find me there. And I'm looking forward to seeing you guys there. And hopefully I'll see you in class soon at one of the retreats. How about that? Or one of the oncology classes. Come join us.
Thank you so much, everybody. See you at 1.
Thank you, guys.